Hi guys, welcome back to the Skin Scoop. I'm your host, Madison.
And I'm your other host, Lexus.
Ooh, speak gentle to me. Talking those sweet tones.
That's how I feel. Today we are doing a little bit of a dive into acne, understanding, conquering, managing as two people that are acne prone.
Yeah, we're sharing our stories.
And going in because I know it's something that a lot of people struggle with.
Mm-hmm.
Genuinely, I see a lot of acne people.
Yeah, we do see a lot of acne people.
Acne, rosacea, and pigment. Yeah. Pigmentation. Yeah, our goal is just to help people understand their concerns better when it comes to acne, lifestyle changes that you can make, just better practices when it comes to acne.
Yeah, there's so much that goes into it, so try to follow along with our ADHD, but it's...
Yeah, we'll probably jump around
a
lot.
If you have ADHD, you will love this podcast. You'll be able to follow so well. Never a dull moment, baby. Bring us into it, Lexus. Let's go.
We're going to talk about basically the formation of acne. So typically, little things can cause you to break out, but typically it takes anywhere from 30 to 90 days for acne to appear on the surface. It takes a while for it to form, and how it forms is essentially just that sticky sebum mixing with dead skin cells and plugging your hair follicle. Follicle. I think I say follicle.
Really?
Yeah.
It's a follicle. Whoa, no, now everything sounds weird. I don't like what you did to me there. I'm confused.
Someone that has acne, their skin actually sheds faster than the average person that has like normal skin. Now, when it comes to triggers for acne, it can be very different for everybody. What triggers me might not necessarily trigger Madison, and vice versa.
Yeah, totally.
So there are things like hormones, menstruation, PCOS, stress, diet plays a huge role. The products that you're using. For me, I do have a hormonal imbalance. I have PCOS, so I have always struggled with hormonal acne, and then I get pigmentation from it afterwards. Dairy can be a trigger for me. Eggs is a really big trigger for some people, but it's not the same for everyone. So when it comes to diet, I think it's really important to work with a naturopath or do a full panel to find food sensitivities. But it can also be helpful to do little tests at home.
Totally.
And take one thing out of your routine at a time and just see if that triggers you. So sometimes I will tell people, because eggs is such a big trigger, take it out of your routine for a couple weeks and see, and then add it back in. And if you break out or it was consistent the whole time, then that kind of tells you, and you can do that with multiple things. Protein powders is a trigger.
Do you find that it's just whey protein? Whey protein is not great for my skin.
Yeah.
Or do you find that pea protein also?
Whey.
Yeah, that's what I was thinking too.
Yeah.
I just wanted to ask you a question.
That's okay.
Oh my gosh. If I drink a root beer, I'm fucked.
Yeah, I love root beer though.
God, me too. That is like
my mom makes fun of me for liking root beer. She says only kids like that shit. I'm
Yeah.
so glad you like root beer.
I get made fun of for it.
That's funny.
People say that it tastes like toothpaste, and I like the taste of toothpaste.
No, I really like that.
But I'll break out.
Yeah.
I break out bad with root beer, which sucks. So I limit having that. A lot of milk I'll break out with, and I've been having a ton of milk lately, so changing products.
Yeah, and sometimes it's hard with the influencer thing going on social media and promoting this one size fits all skincare routine. There's a lot of things that, and ingredients specifically, that acne prone skin isn't necessarily going to like.
Dimethicone.
Yeah, vitamin E, algae, seaweed, stuff like that. Sometimes your skin...
Oh, maybe that's why I'm breaking out.
Yeah.
I've been having a ton of seaweed lately.
Well, there's lots of salt too.
Yeah.
So diet plays a huge role. And when you have a lot of inflammation, that's also going to cause you to break out more. When we have things present itself on the surface of the skin, it's always going to be a result of disharmony internally, whether it's hormones or inflammation.
I love the verbiage you use. Disharmony? Like, wow. Oh my god, I love that. Any hooters?
But I think acne is really common in adult women, and it's not necessarily talked about because people typically think that acne is something that you go through when you're going through puberty, and a teenager, but that's not true. I think now more than ever, I'm actually treating women in their late 20s, early 30s that are suffering with acne.
The children that we have coming in, or the teens, they're more just congestion and fungal.
Yes, lots of fungal acne.
Yeah, what the fuck? I just saw another one the other day.
Really?
Yes. And I was like,
Well, this is perfect because this brings us into different types of acne. Because there are different types of it. And there's also acne imposters. And technically fungal acne is an imposter because it's not actually an acne. So we have non-inflammatory acne. That's the stuff that we as estheticians can extract. Blackheads.
Well, that's the stuff that estheticians should only be extracting.
Yes.
There are some people who will pick and poke at inflamed acne, and it's just...
But you have blackheads, those are open comedones, and whiteheads, those are closed comedones. We should not be extracting things that are like pussy, truthfully, and that happens from excess sebum. Typically, you're going to see this on someone that has an overproduction of sebum, someone that is oily. Not to say that it's only those people that you'll see that have it, but typically they're going to be super oily. So it responds really well to salicylic acid, glycolic acid, retinol, mandelic, zinc. Taking zinc is really good, but also for someone that has that inflammatory acne, clay to just put it on your T-zone, dry up that excess. Basically, in that stage, we want to try and manage your sebum production.
Yeah.
And exfoliate your skin.
It's a process.
For sure.
Like, once you come to us and we get you on these active ingredients and we're starting to exfoliate, your skin is like, what the hell are you doing to me? What is going on? Because my skin is going through that right now from previously being sick and going off of actives, and now I'm going back onto them, and my skin's like, what the fuck are you doing?
Yeah,
and
that's
dry.
a necessary evil.
Yeah, like, it's gonna happen. So
going through the purging phase.
It's a process, but all for the greater good.
Yeah.
All for the greater
good.
But
I can't stress enough how important it is to work with professionals when dealing with acne, and that's not just an esthetician, because you could be using the best skincare and getting the best treatments, and if there's some funky stuff happening internally, or you're continuously eating food that your body doesn't like, you're always going to be breaking out. So we have to get to the root cause.
Yeah,
and I always find when we get those acne patients, it's really hard to manage expectations and keep them compliant, because they're typically at a point where they've tried everything and they don't necessarily want to go on Accutane or things like that.
Shouldn't want to go on Accutane.
Or they've been on Accutane and they've had 4 failed cycles and they're at a crossroads and they have no idea what to do and they're just frustrated and they've been to a million different people that have told them a million different things. But moving on.
Also, I just want to point out, you keep looking at the camera and I think it's so fucking funny because it's not rolling.
I know.
Oh, do you know?
Yeah, I'm just looking around.
Oh. Just checking the place out. I'm just curious. Continue. Back to acne imposters. Oh, no, sorry. No, we're talking about inflammatory acne.
Yeah. I will say, though, inflammatory acne, that's your papules, pustules. That is typically easier to clear than non-inflamed textural acne.
Yeah.
But this kind of acne responds best to benzoyl peroxide, unless you have a sensitivity, which a lot of people actually do.
I'm so sensitive to BP.
Yeah.
Yeah, I still use it.
Sulfur's really good for
Oh yeah, love sulfur.
CBD.
Yeah.
Retinol, mandelic. I still treat someone that is stage 4 that has gone to a derm or something like that and didn't like the approach, because some derms automatically go to Accutane. Some people don't want to do that. Yeah. But we don't deal specifically with nodules and cysts. So if it is something that needs to be drained or anything like that, you would have to work with a derm for that, for sure. Those are painful, deep lesions that are definitely going to cause scarring more times than not, because there's just so much inflammation there.
Some of them need to be cut out.
Yeah, like surgically
Like the
removed.
sac needs to be...
Oh, you always have to remove the sac or else it'll refill.
Yes.
And those are like the big ones that you see on Dr. Pimple Popper. The reason that you want to have professional extractions done is because you might not be doing it properly at home. We want to get everything out of there because your pore can stretch. So if you leave it filled up, then it will just stay bigger and things will keep filling it. Now, when you have a dilated pore whiner, that's a big blackhead. Usually it leaves basically a crater in the skin, and some people have to have those stitched back up, depending on how big it is. Sorry, that was a ramble. I'm very passionate about blackheads. Not to deter any people that are, stage 4 acne and want to work with estheticians. It's just about working with the right one, because if you go to the wrong one and they start going to town on those inflammatory lesions on your skin, you're going to be left in a way worse position than you came in. And then you risk actually having like skin infections and stuff like that, where you have to go on antibiotics.
Yeah, like a staph infection.
Yeah, so
skin.
Just make sure you're, really looking at who you're working with. Esthetician goes to extract those pussy ones.
Tell that's a
red flag.
To back off.
Yeah. There's also a bunch of acne imposters, and sometimes it can be hard to differentiate what is what. So when someone comes in with, acne rosacea, how do you know it's acne and acne rosacea or whatever? Decipher. We were talking about this as well. Fungal acne. Yeah, it's called fungal acne, but it's actually a form of folliculitis. So they can present as non-inflamed acne because it's textural. So sometimes when a person has a combination of them, it's hard to tell, and you have to really treat acne in stages. So you're always going to first treat the inflammation, then you're going to treat the non-inflamed, and then any scarring, PIE, PIH, all that, and then you put them on maintenance. But once you treat them, if they have multiple and you see that wet kind of textural, typically it's on the forehead, it can be really itchy, and you can't extract it, that's fungal acne. It's a form of folliculitis. KP.
I didn't realize it was a form of folliculitis.
Yeah.
That's really fascinating.
Basically yeast that's feeding on that oil. So if you're someone that has fungal acne, you want to make sure none of your products have oils in it. You want to make sure that you're not eating a lot of sugar, no wet hair, like things like that. There's a whole process. In KP, keratosis pilaris, typically that's on the arms and
Yeah, I get KP.
Though. Yeah.
KP on the arms, KP on the legs, on the thighs. Ugh.
Yeah. Go to a professional that knows how to decipher what you're struggling with and how to treat it, because there's a different way to approach each thing.
Yeah, there's so many different forms of it, and the approach is not the same for every single one. Okay, so some topical treatments that you can use if you are suffering with acne, depends on what kind of acne, but benzoyl peroxide is great for inflamed acne, pustules. It's used as a spot treatment, used nightly. You don't want to use it during the daytime because it will make you light sensitive or sun sensitive. So it's great to use over top of a moisturizer. That's how I like to suggest it.
You're the best.
Stop it.
You're literally so fucking smart.
Oh my god.
I listen to you and I'm like, wow.
Stop.
She's so smart. When did she learn that shit?
That's what I think about you. Literally.
We just think that about each other.
Yeah, we're just like, oh, I'm so in love. Salicylic acid is great to use for blackheads, close comedones, T-zone.
Honorable mention, mandelic acid is phenomenal.
Yeah, we love mandelic. I love to use salicylic acid on my back, my chest, my
KP.
bum, my arms, my thighs. And then we're moving on to retinol. Retinol's great for everyone and everything. It doesn't even have to be acne, but it increases your cellular turnover and helps to shed dead skin cells, soften the skin, smooth the skin.
Be cautious of the prescription retinols that you're getting from your doctor, because they do have a lot of pore clogging ingredients in the cream version. So if anything, always ask for the gel version. Yes.
And also when you get a retinol from your doctor or derm, those retinols that people are prescribed have absolutely no delivery system in them.
Yeah.
Like, it's literally you put it on and that retinol is active and it's going. So when we talk about a delivery system in products, I like to think of it as like a transport truck. And this transport truck is carrying all of these ingredients in the back part of it, and it's driving it into your skin, taking the highway all the way around, and it's moving very slowly into the skin. When we're using retinols at the clinic, they have a 8 to 12 hour time release.
Yeah. So you're getting a slow, even amount of it. It depends, though, because wrinkle and texture repair is a wrinkle balm.
Yes.
I mean, a retinol balm.
Yes.
But essentially that helps eliminate the possibility of like intense anticipated reactions like dryness, tightness, flakiness, redness, because we don't want to destroy your skin barrier. So a lot of times we get people that come in after using a prescribed retinol from the doctor and their skin is like red, skin barriers destroyed, their acne looks worse, and it's hard because sometimes that's just your anticipated reaction with retinol, and you are going to go through that purging phase. So you have to really make sure that you are finding someone that knows how to tell. Exactly.
Yeah. That also turns a lot of people off from using retinols. Like, I've had so many people come in and be like, oh, I don't use retinol. Like, I had one prescribed to me and it just damaged my skin.
Yeah.
I'm like, let's try you out on the Illuminate 0.5%. It'll change your fucking life.
Or the doctors don't tell them to use sunscreen with it. So I'm like, have you been using your sunscreen? They're like, no, and I use benzoyl peroxide. And I'm like, what is happening?
Like,
and when we're exfoliating, we always need to make sure that we are hydrating and moisturizing as well.
Yeah. A lot of people with skin concerns or with acne think that throwing all of these active ingredients at it and just drying it the fuck out is going to solve all your problems. I promise you it will not, and it will make it 10 times worse.
Yeah.
It's all about balance.
Just because we are estheticians and we know how to deal with acne doesn't mean that we always get it right away, because with acne, it's a lot of trial and error, and again, unique to each person.
Like, I just had that young girl come in, and when she came in, she had 3 forms of acne happening, but I could only see 2 forms of acne happening when she came in initially. And then 6 months goes by, I believe. Like, I didn't see her all summer, and now that it's the winter, she needs her moisturizer again. And she came in, and I'm looking at her, and I'm like, your skin looks so much better, but now I see that you have fungal acne.
Yeah.
And this is what we have to do for it.
Yeah.
So we don't always get it 100% right the first time, but like, stay consistent with your esthetician and we will figure it out.
It's very personal to us.
It is.
We get very invested.
Yeah.
And we get happy for the little wins for you.
Oh my gosh. Yeah.
There's lots of treatments you can do. Chemical peels, laser genesis, light therapies like blue light, extraction facials when needed. Basically, we just want to get you to a point where you're doing maintenance, and your maintenance is basically everything that you did to get yourself clear in the first place.
I need to give a little PSA.
Okay.
What does PSA stand for?
Public service announcement.
I need to give one of those. The next person I see microneedle over active acne, I'm coming for you. I swear. If we dermaplane over active,
oh my gosh, I saw
acne.
one. It was crazy. Like, she
Blood.
was sliced and diced.
Yeah, let's think about it, people. Let's use our brains and let's break this down. This is a PSA. I'm very passionate about this because the amount of times that I have seen on social media people microneedling over active acne and actually like jamming the device in there. Oh, Lord have mercy upon me, because I can't handle it. So let's think about it. This is a pustule with a white top on it. You can see the pus. You can see the bacteria in this pimple. And we are going to take little tiny needles and just jam it into the top of this pussy pimple. And jamming it in there. Okay? Dab, 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 dab. And then you're going to take those same needles and dab, dab, dab on an area of skin that does not have any pimples. What do you think is going to happen? What are we doing? Spreading bacteria.
Yeah. I'm not for it.
Well,
I don't know.
Fuck, I hope not. I would be judging the shit out of you.
What are some other things to help people with managing acne, things that they can do, lifestyle changes, zinc, omegas, probiotics if you need them? Really
Pay attention to your body.
Know your triggers.
Yeah. Like, body will tell you when something is not right. Will come out in some form of acne, rash, dermatitis, like something. So then reevaluate your situation. Like, think about what is happening in your life at that moment. Why is this happening to you? Well, maybe it's because you just drank 4 root beers and you had a really crappy day and your cortisol levels are spiking. Like, there's so much to it. So it's understanding your triggers and being very mindful of everything around you.
Yeah. And purging is a necessary evil if we want to stop. Like, I know a lot of people don't want to go on actives because they don't want to go through the purging phase. We need to go through it.
You're speeding up that 30-day cycle.
Yeah.
Like, you're pushing all of it out. You have to go through the purge.
And we want all of that stuff below the surface to come up.
Yeah. Like, it's actually a good thing.
Yeah.
It sucks in the moment, but
Yeah.
like
Necessary
we
evil.
always say, it always gets better.
It always gets better.
It always gets better.
But I do a lot of hand holding because it is an emotional thing. It takes a huge toll on someone's self-confidence.
Yeah.
And I totally get it. I've struggled with it.
Yeah.
And I'm here.
Yeah,
to help.
it's hard, but we're a great support system.
Yeah.
We let our patients message us on Instagram. Like, I tell people, If you ever have any questions after treatment, if you ever have any questions and it's 11 p.m. at night, message me.
Yeah.
Like if we just did a treatment and you're worried about something or anything, message me.
Yeah.
If I don't answer, I don't answer. But if I do, great, I was awake. You know? Like,
yeah.
We want to be there for you.
We do. And yeah, just make sure you're looking at ingredients that you're putting on your skin. That's pretty much it, I think.
Yeah, do you want to hit them with the question of the day?
Yeah. What's one acne myth you used to believe?
Ooh.
Toothpaste.
I was going to say toothpaste.
Or that if you have acne, you have dirty skin. Or
oh my gosh.
you need to wash your face more.
Yeah.
Or scrub the acne off.
Yeah.
Or like whatever BS was spewed about it.
Yeah.
There's so much to it, whether it's genetic or hormonal or stress. Doesn't mean your skin's dirty. It doesn't mean you're doing anything wrong.
Mm-hmm.
Thanks for tuning in to our epi. Sorry if I rambled. I'm just very passionate about this, and I'm very passionate about pigments. So if you ask me any question about either,
yeah, the bitch rambles.
It's likely you'll get
a lot.
Yeah.
It's a good thing though. You're so educated. Like,
well, they're just two things that I've struggled with myself.
Totally.
Like always acne, and then the acne turns into pigmentation.
Yeah.
And as someone that is darker, that's just what happens to my skin.
So cute. You get PIH, I get PIE. I'm February, you're March. I'm 9, you're 10.
Yeah.
I'm the moon, you're the sun. Yin, yang.
Alex, yay.
Yeah, like, holy shit. Okay.
Love you.
Thanks for
like,
joining.
comment, subscribe, share.
Thanks
Happy
for
Monday.